Okay, so where the scene is safe, I've got the correct PPE on, which is gloves. In this case I don't have any, but I'd have gloves and glasses on. If the patient was conscious, I would explain the procedure to the patient and obtain consent. In this scenario, the patient is unconscious and we're utilising the jugular vein due to being the only prominent vein in this circumstance. So you'd want to make sure that the patient is in a position of comfort and that you have adequate lighting. Need to make sure that all the appropriate equipment is all set out close by. So we've got alcohol swab, we've got gauze, op-site dressing, one-way valve, a 10ml syringe with saline in it for the flush, and a label. We're going to select the appropriate size cannula for the patient condition, so in this case like trauma, so we're going to select an 18 gauge cannula to pump some fluids through this patient, and also make sure that the sharps container is in reach. So the patient must be supine, so preferably we're going to make sure that the head is down to distend the vein. This just prevents an air embolism. We've also assessed that there is no indications of a C-spine injury, and we're going to turn the head to the, so I'm going to use this vein here, so we're going to turn the head to the opposite direction. I'm then going to swab the site with the alcohol wipe, so maintaining aseptic techniques. So inside to out. And then maintaining the non-touch technique after the site has been cleaned, so you don't want to touch it after you've already swabbed it. You're then going to, with one finger, provide an anchor, so pressing on the vein just above the clavicle, so to push down on the vein so that it comes up there. Going to stretch the skin using the thumb to help stabilize the vein so that it doesn't roll off to the side. And then if the patient was conscious, you'd warn the patient when you're about to insert the cannula. So you just say a slight scratch and then insert it. But in this case, the patient is unconscious. So we're going to insert the cannula at a 15 to 30 degree angle. So just using a pin as the cannula. So we're going to insert that. And obviously when a flash, so you insert a little bit, once you get a flash back you then lower it and then insert the bevel a bit more and advance 2 to 3 mils so that the sheath is then in the vein. So then you want to slide, obviously you'd slide the cannula out, the cannula off the needle, and then without advancing further into the vein. Okay, so then you'd remove the needle and pop it in the sharps container. And when doing that, so yeah, take it out, pop it in the sharps container. So when you do that, you then tamponade the vein so that no blood, try not to get as much blood spill out as possible. Then you want to attach a one-way valve to the end of the cannula, and then you want to place in around 10 mils of saline. Flush just to make sure that the cannula is in the vein properly. Obviously, if the patient was in pain when doing this, you may not need to rethink about moving it, and just making sure that there's no swelling, so there's no fluid going outside of the vein. Okay, so then do that, and then just tape it off. Place the op site on there and tape, and then add a label, so obviously what time that you inserted it, etc., and date. And that's it.